Hey there, YouTube fans, how you going? Let me start this little talk of mine with let's have a little talk. This is one of the most important discoveries in my own health that I've ever had in my life, I think. It's got to be up there with the greatest. Man, I don't know where to start, to be honest. Okay, let's just start. Look, after a long battle, let's say about at least 7 years, it looks like I've had chronic anemia, going in and out of iron deficient anemia for the past 7 years. And now, before I forget, one of the issues is also the weight. And my weight came on from chemotherapy, a lot of it. And while I remember weight is related to a higher need for iron in your diet or in supplements. Now, all of the stuff I'm going to talk about, most of it is going to be backed up by science. I don't just believe in, willy-nilly stuff. So what I've done is I've done my research and I've had my bloods, and there's some anecdotal evidence as well. I'm still recovering from anemia, but I felt so much better today. It's not funny. I've had about four or 5 days of taking iron supplements, and I've taken iron maltose, and it's the equivalent of 100 milligrams of elemental iron per tablet, which is 200 milligrams a day, which I got from the chemist or pharmacy. Back in 2014, I had chemotherapy, and I've talked about this before, and we all know that chemotherapy can destroy your red blood cells. So you're going to get anemic. There's photos of me with no hair and really pale. Obviously, I was anemic. And what all the chemo did, it made me put on weight, which made a higher demand for iron. And then I also went on testosterone replacement therapy, which is a higher demand for iron. It's well known that testosterone replacement therapy does really good hemoglobin. It's one of the best things that it does. But if you're deficient in iron, your hemoglobin is kind of like anemic itself. It's pale, it's pink color, when it should be a nice red color. There is a word for it. I think it's called hypochromatosis. I think it's called. Don't quote me on that, but it's something like that your hemoglobin isn't the full color. Now, if you have ongoing bleeding, let's say, look, a lot of people got hemorrhoids, and let's just leave it at that. And if you got heavy periods, if you're a woman, or if you have both, unfortunately, this can lead to iron deficiency anemia. And also, it affects so many things. And I won't talk about the symptoms. That's pretty easy to look up. But I mean, one of the big symptoms, of course, is fatigue. So people who think they have chronic fatigue syndrome, they might have anemia, which is what looks like. I think that's what my story was. I thought it was chronic fatigue, but it might be anemia. It can also, anemia can impair your blood glucose. It can make your diabetes worse. So I was having higher blood sugars in the morning. I couldn't work out what was going on. I was taking more and more medicines, taking the natural berberine, and it just kept on being high. What it actually does, there is a specific word for it, but essentially it's your liver. Your liver is becoming more insulin resistant, and it impairs your glucose your glucose situation, basically. So, and also the high heart rate that you can have with just trying to struggle for oxygen throughout your body pumps up the heart rate. And I'm just telling you that I'm still anemic, so it takes a while. It takes months to get your iron levels back up, and your body making that hemoglobin, the healthy hemoglobin again. But it can lead to hypertension. It can lead to some people, which is high blood pressure, and some people taking iron or taking iron infusions or being anemic can lead to low blood pressure, apparently the doctor said to me today. And the other thing is there's a possibility of a relationship between psoriasis and anemia, or iron deficient anemia. And 50%, in one study, 50% of the people who had psoriasis also had anemia. I did notice a psoriasis flare up for the last several months, and let's hope that that is part of the issue, and I hope to keep you informed on that. Fatty liver can lead to fatigue as well. This is important. If you got inflammation in the liver, say you got cirrhosis of the liver, which can be brought on by a lot of alcohol, like being an alcoholic, or you have fatty liver disease and you have high elevated liver function test, LFT test, it can mess with your iron study. So I had doctor after doctor not pick up on this in me, that I was chronically anemic and going in and out of, even in the blood tests, being anemic, because possibly the inflammation in the liver was messing with the iron studies, the blood tests. So I think that covers most of the things that I can think about. I'll just leave it with this one point. After supplementing with a couple of 100 milligrams of iron, now you just can't take anything just like that. You have to have the right preparations, and I said that I took iron maltose. Iron maltose is in tablet form, but it's messing with my stomach and giving me headaches and that. But several days of that, I absolutely have noticed a difference. I was walking around the hospital all day today. I helped my sister, be picked up from the hospital and that. And I couldn't believe that I wasn't half dead after running around all day. I was only a quarter dead, feeling a quarter dead after running around. One of the other interesting things is a side effect of anemia. I started biting my tongue, and I thought, I'm not really speaking very clearly right now because I probably still have a swollen tongue. I didn't realize. I thought, no, my tongue's swollen for some reason. I don't know what I'm eating or what I'm doing. I kind of just ignored it. But a swollen tongue is another symptom of anemia. So I was actually biting my tongue on each side every now and then, and it's because the tongue was, and is probably still, inflamed. Look, I'll just briefly talk about some of those symptoms. There's the fatigue, of course, the brain fog, the rapid heartbeat, the palpitations, the swollen tongue, loss of hair, craving ice. You want to chew ice. It's called pica or pica, depends on how you pronounce it. Or if you crave dirt or things like that, that's pica. What else is there? Dry skin was another one. Yeah, there's several symptoms of anemia. Look, this is almost 10 minutes. I'll leave it there. One of the most significant findings in my health in the last 7 years. I think we got it this time. Hopefully this is the answer to a new beginning, new energy, new life. All right, God bless, guys. Remember to like, comment, subscribe. I hope that's helped somebody out there. Take care, guys. God bless you. Teacher Sal out.